My name is Dr. Wanyika Hannah. I'm a dermatologist. I specialize on the skin. So the bulk of my patients will present when they have a skin problem, and our work is to return an abnormal skin to a normal skin. Skin diseases are very common, but what happens is that not all skin diseases are painful, or not all of them that people will scratch. So it is not all people who have a skin disease who present to the doctor, because unless they have a symptom, then they'll just stay with it at home. But skin problems are quite common. They range from infections to reactions or just to cosmetic complaints. Dermatology basically involves management of the skin. You can have a primary skin problem where you are only aiding on the skin, or someone may have another skin disease, another disease in the body, but it is also having a skin symptom. So those are the kind of people that we see. You could also have a complaint of the skin, not necessarily a sickness, but maybe a cosmetic problem, like you don't like a certain part of your body looking the way it does. Now, when we talk about dermatology, we treat the skin, the hair, and the nails. When we talk about skin diseases, there are several types. We have infections. Infections are treatable. Then we have skin diseases. It is not a germ, but it's a real disease on the skin. Many of them are treatable, and many of them are just controllable. We have a very big group of skin diseases which are genetic, they are inherited. That means you cannot cure them, but you can manage them for someone to live a healthy life. Most of the causes of skin diseases are infections. You can have a fungus on the skin where someone presents with like dandruffs. They could be on the skin or the head, the scalp. You could have a viral infection where they present something like chickenpox, which everybody knows. Or you can have a bacteria which gives pus on the skin. So those are infections. Infections are the commonest, and then coming second are reactions on the skin. Maybe someone has applied a cosmetic on the skin, or they have applied a chemical on the skin and they have reacted. And then now we have the genetic diseases falling after that. People need to avoid trying out so many things, because the more things you try out, the higher the chances that you might react to one of them. If someone wants to venture into the cosmetic industry, it is always good to be advised, either by someone who has done cosmetics, so they can tell you these are the cosmetics that you can use. But if you just walk into a shop and pick something, most likely you'll pick something wrong for your skin type. Currently, we have a lot of advancement in dermatology treatments. Like we are using a lot of what is called cryotherapy. This is a treatment where they use temperature, very low temperatures, to treat skin tumors or skin growths which have developed on the skin. We also have laser coming up very well in Nairobi. But you know, the problem with laser is the cost. So not very many people would afford that. We have a lot of problems because we don't have companies which make those machines in Kenya. That means even if you buy one and it breaks down, we have no one to maintain. We don't have that backup to train more people how to use. Because if it is only one person who knows how to use a machine, then that machine has very limited use. And the training, we don't have many people who are trained in dermatology and exposed to those machines, because machines work with experience. That is really the problem. But we have a lot of resource information where these things can be developed. There isn't a good method of treating that the other. It depends on the diagnosis of the person. So the person will present, a diagnosis will be made, and they'll be offered the most effective treatment. So if the doctor chooses you to have cryotherapy, which is the cold treatment, then that is the most effective for your condition with minimal side effects. Because the most effective treatment is the one which has a short treatment time, it will have minimal side effects, and it will be very effective. I think what people should know is that the sun is one of the enemies of the skin. So the earlier a person starts protecting themselves from sun damage, then they are going to escape a lot of skin problems. The other thing people need to know is that it is not the sunlight which is damaging the skin. It is the ultraviolet rays which are within the sunlight, and those ones are invisible. They come through the crowds, they come through the walls, like the glass walls. So they don't protect you. The fact that you are working indoor, so long as your room has a window somewhere, then the ultraviolet rays will come through. Hakuna kitu kinasema mtu yule mweupe ndio anaonekana ni sura mzuri, na ndio watu wengi wanaenda kutafuta hizo chemicals za kufanya wawe weupe. Hizo chemicals zinakuwa na madhara mingi sana kwa mwili. Kuna moja wanatumia inaitwa hydroquinone. Hiyo inaweza kufanya uwe mweusi zaidi, na pia inaweza enda kwa damu na iharibu ndani kama figo ama maini. Kuna ingine wanatumia inaitwa steroids. Hizi ni dawa za madaktari, lakini wanazitumia za kufanya mtu awe mweupe. Hizi ukitumia kwa muda mrefu ama utumie kwa area kubwa kwa mwili, unaweza pata kilo ziende juu sana, sukari haribike, uwe na kukibia kwa moyo, na ngozi iwe na vidonda ambazo haziponi, ama iwe na ugonjwa ingine ambayo haiponi. Kwa hivyo hizo dawa za kujifanya mtu awe mweupe zaidi ni mbaya sana. Mtu tu akae na rangi yake na atakuwa mzuri.